I'd love to talk right now to Senator Tammy Baldwin. She's from Wisconsin, and she's, of course, a member of the Senate Health Panel. It's going to be talking to a recently fired CDC director at the top of this hour. But, Senator, I want to talk to you about something much closer to you. You understand what I was just talking about because you were sadly a part of that Minnesota story when the top Democrat in the House was assassinated along with her husband, family dog. And another senator was shot 8 times. His wife shot 9 times. And there was a kill list that had 42 people on it. You were on that kill list along with a lot of other Democrats. Obviously, that gives you so much reason to pause. But I'm wondering, from your perspective, how do we move forward through this? You've been on a targeted hit list. You have known people that have been assassinated. We understand the horrible pain that so many people are feeling about Charlie Kirk's assassination inside the White House, across the country. What words of hope do you have to provide them?
Well, I think you were just naming it before I came on, which is the need to tone down the rhetoric, to really leaders need to try to unite here. And it's a very challenging moment to do that because of sort of the echo chambers in which communication exists that is relied on by the right and which is relied on disproportionately by the left. They're separate conversations, and so it's hard to have unity at this time when there's not a big overlap. But, you know, the hearing that I'm going into is relevant to this because there is a distrust right now in certain leaders and when they say certain things and make recommendations. And when people are fired because they're trying to uphold the truth, uphold the science, this has real impact on people's lives. And so, you know, the idea that there are wars of words at the same time that we're seeing this political violence, we've got to change the rhetoric. We've got to make sure that we're allowing people to scrutinize what leaders say to find out whether they are based in fact, whether they are in scientific agencies based in science and not conspiracy. And I think that rebuilding of trust is extremely important at this moment. Because we're talking about political violence, but frankly, the purveyance of misinformation or disinformation in public health can also cost lives. And we're seeing that right now around the United States. And it's frightening, and it's one of the reasons why I've called on RFK Jr. to resign, because I think he is a dangerous person at this moment at the helm of the agency that should be focused on cures and breakthroughs and vaccination, and instead is uplifting disinformation.
So, Senator, to that point, at the top of the hour here, you'll be chairing that committee, part of that committee hearing that involved the former CDC director, Robert F. Kennedy Jr., claims that he fired her in part because she herself told him that she wasn't trustworthy, a statement that spoke, that hit many people as perhaps not true. So let's talk about what you expect to hear from the former director today. And to your larger point, what are your concerns right now about Secretary Kennedy's leadership as at the nation's top health agency?
So I do expect Dr. Menarez to outline the events that occurred in late August before she was fired by RFK and the White House. I have seen her testimony in advance, and I expect she will go step by step through her being basically told she was required to confirm or authorize vaccine recommendations sight unseen, as well as fire top leaders in the Centers for Disease Control who were scientists, who were experts, and who had different advice and guidance for our nation based on that science than the newly appointed, hastily appointed Vaccine Oversight Committee that RFK Jr. put in place, loaded with people who share some of his conspiracy views about vaccination. So I expect us to hear that. But look, there's a lot of consequences to what RFK Jr. has done. You know, I did not vote to confirm him, but he, I know, gave commitments to Republicans to vote for his confirmation that he wouldn't do precisely the things he's doing: mass layoffs, funding freezes, and vaccine guidance that we expect to see later this week that is not consistent with the science. Look, it has real-world consequences. In Wisconsin, we have a measles outbreak in one of our counties with 36 people, including 2 people who've had to be hospitalized, all unvaccinated, all had been exposed to people in Texas with the measles, or not all of whom, some of them have spread it since they've returned home to Wisconsin. And we also had a tragic event in Milwaukee when 1,800 school children had to be displaced from their school because of the presence of lead paint. And when we called the CDC from Wisconsin to get help from their childhood lead poisoning experts, they had all been fired. And they said there's no help that we can provide. And we've seen the real life consequences of somebody like RFK Jr., who is doing, is presiding over these mass firing and these funding freezes, and pointing fingers and not accepting the responsibility that he should shoulder.
Democratic Senator Tammy Baldwin of Wisconsin, thank you so much. We really appreciate you being here today.
Thank you.